We have healthcare tied to marriage. That has a negative impact if you cannot access those things. We're talking about supplemental security income, which is called SSI, and sometimes SSDI, as well as Medicaid benefits. Those are the things that people would lose if they were disabled and then become married. In New York State, where I'm at, the income threshold is like $68,000 if you're a single person and $92,000 if you are a married couple, as well as there are asset limits. So how much assets you can have in the household. And, it goes into how many cars you can have, what is the value of the home that you have. So all these different things are added into that asset value. So that really is detrimental if you want to become married. Remember that these rules were made back in the 50s and 60s, and I think updated in the 90s. So you really antiquated ideas of care, how we give care, who is deserving of care, and what is the role and responsibilities of a partner or a spouse. The partner's income being accounted for, I think, goes back to the ways in we think about disability and care, that it is on the spouse to be able to do this. It's also that kind of thing that I think just ingrained in our society about coupledom and what should be the obligations of a partner and spouse. And so that they should be taking care of you rather than community care being a standard and practice that we have in this country.
My fiance at the time and I were looking to get married. We had set a date, but the behind the scenes was, how was I going to pull this off? Because if I get married, then I lose my personal care, the ability to get my wheelchair fixed, my health care. If we go and I say we're married with state recognition, the economic disaster would be crazy. It was a tug of war because we wanted this in front of the eyes of God and family.
It can impact, who wants to be with you. Societal says that, if you don't have that piece of paper, it's not a legitimate relationship. You're not serious about the person that you are with. Look at these arbitrary thresholds that are created from SSI to Medicaid to all of these different services and saying, why is that even there? And how do we make the policy to be more inclusive, regardless of your relationship status, to be able to say, should we be co-signing people into poverty? Is this actually working to get the people the care that they need? I think a universal healthcare system would also be beneficial, not like this Medicare for all, because that's actually not inclusive of disabled people, but a true universal healthcare system that wouldn't be tied to marriage or employment would be very freeing for disabled people.
Groups of individuals got together and said, because of your human condition, we don't think you should have the right to marry, the right to do this. Your income limits can only be this. And because you're a burden on society, we'll give you enough that you ain't dead, but not enough to live.